Welcome to This Explainer. Today, we're diving into a fascinating paradox that literally affects every single one of us. On one hand, you've got the ultimate life-saving mission of healthcare, treating the sick, healing injuries, and saving lives. But on the flip side, you've got the brutal, incredibly complex financial reality of actually keeping these massive facilities running. I mean, it takes an absolute mountain of resources to keep the lights on and the ER doors open. And honestly, the pressure on healthcare delivery organizations right now, it's higher than it's ever been.
To figure out how these places actually survive, we're going to follow this roadmap. First, we'll look at the healthcare landscape. Then, managing high operational costs, navigating regulatory scrutiny, the workforce challenge, and we'll wrap up with quality and patient care.
Okay, let's dive right into Section 1, the healthcare landscape, fierce competition, and fixed costs.
So, to really grasp the numbers here, we first need to understand the intense pressures driving this whole industry. The financial and competitive landscape of healthcare delivery is, well, it's incredibly demanding. Sure, demand is driven by things like demographics and illness rates, but the supply side, that's where things get really complicated. Hospitals and clinics are weighed down by exceptionally high fixed costs. You've got to pay for highly specialized labor, right? And you have to maintain these massive, technologically advanced facilities. But at the exact same time, there's this intense regulatory focus on reducing the overall cost of care. It's a huge squeeze. And to top it all off, these entities are locked in fierce competition for patients and resources. They aren't just competing against one type of hospital, they're battling it out with private systems, nonprofit organizations, and religious healthcare systems. Margin compression is very, very real here.
Which brings us to a really critical question. As that squeeze gets tighter and tighter, how do hospitals track and survive these immense pressures? I mean, how do you even measure the hidden operational risks before they literally bankrupt a facility?
Well, the answer actually lies in standardization. Enter the SASB Healthcare Delivery Accounting Standards. Now, this isn't just some boring table of numbers. It's a vital diagnostic tool. Investors and executives use these exact standardized metrics to measure and manage those hidden financial, environmental, and operational risks. From energy management all the way to data security, these standards reveal the true health of a healthcare business. Let's look at how they manage the first massive hurdle.
Section 2. Managing high operational costs, energy and waste. When you're operating huge, energy-intensive facilities that run 24/7, your environmental footprint translates directly into massive utility bills. Just think about all those life-saving machines, the climate control, the intense lighting a hospital needs. It's nonstop. So SASB standards require entities to track the raw gigajoules of total energy consumed. But it goes a step deeper. They also track the percentage of grid electricity versus renewable energy. And why does this matter? It's simple, really. Legislative attempts to limit climate impacts can cause wild price volatility in fossil fuels and conventional electricity. So entities that up their renewable energy percentage are effectively limiting their financial exposure to those sudden, unpredictable energy price spikes.
Then you have the sheer scale of the waste, and hospitals generate a staggering amount of it. We're talking cultures, pathological waste, sharps, hazardous pharmaceuticals, the whole shebang. Regulated medical waste typically ends up in 3 final dispositions. It's incinerated, recycled or treated, or sent to a landfill. The crucial takeaway here is that disposal fees for these types of hazardous materials are usually way higher than just your regular, everyday waste. So having enhanced waste segregation strategies and recycling programs, that isn't just a nice thing to do for the planet. It is absolutely essential for limiting those massive, fixed disposal costs we talked about earlier.
Moving on to Section 3. Navigating regulatory scrutiny, data, pricing, and fraud.
Hospitals are literal treasure troves of sensitive information, which unfortunately makes them prime targets for cyber attacks. The standards require tracking data breaches, making a really critical distinction between basic personal data, things like your name or address, and personal health data, which reveals highly specific information about your physical or mental health status. Think about it. If someone steals your credit card data, yeah, it's a massive headache. But if they steal your psychiatric history or a terminal diagnosis, that's completely devastating. Because of this, jurisdictions require strict administrative, physical, and technical safeguards. Failing to protect this confidentiality doesn't just erode patient trust, it results in devastating monetary losses and massive civil penalties.
Another huge area of regulatory scrutiny is medical fraud. Regulators are constantly on the hunt for specific violations. We're talking about things like upcoding, double charging, or the absolute nightmare scenario of falsifying diagnoses just to justify unnecessary procedures. It also includes shady stuff like accepting kickbacks for patient referrals or misrepresenting non-covered treatments. If staff are caught engaging in these practices, the fines, the one-time charges, and the reputational damage can be completely crippling to a hospital. So entities absolutely must maintain strict compliance programs and robust whistleblower protections.
And if you've ever tried to figure out what an X-ray is actually going to cost you before you get it, you know exactly why regulators are pushing so hard for billing transparency. To ensure compliance here, entities are tracked on whether they publicly display pricing information for their 25 most frequently billed services. Making this pricing crystal clear to patients, whether they're paying out of pocket or using insurance, is rapidly becoming a fundamental requirement. It's crucial for protecting brand value and staying out of the regulatory crosshairs.
All right, Section 4, the Workforce Challenge, Safety and Retention.
Look, you can have the absolute best facilities and the tightest compliance in the world, but the entire model completely collapses without the highly skilled humans running it. And right now, the industry is facing intense current and future talent shortages. To understand how well a hospital is actually managing this, they track turnover rates. Specifically, they separate voluntary turnover, like a resignation or someone retiring, from involuntary turnover, like a dismissal or downsizing. And they track this across three main categories: physicians, non-physician practitioners like nurses, and then all other employees. High voluntary turnover among physicians, for instance, that is a glaring, flashing red warning sign about a hospital's talent retention efforts.
Now, take a close look at this number, 200,000. In healthcare, employees are routinely exposed to injury, illness, and infection. It's just part of the job. So, to standardize safety across the entire industry, they calculate what's called the Total Recordable Incident Rate, or TIIR. That formula takes the number of incidents, multiplies it by 200,000, and then divides it by the total hours worked. So why 200,000? Well, it actually represents the exact number of hours 100 full-time workers would provide annually if they work 40 hours a week for 50 weeks. It gives us this perfect, standardized baseline so we can compare a massive hospital network right alongside a small rural clinic.
But what actually counts as a recordable incident? Well, it's a harsh reality. Healthcare workers face some of the highest rates of occupational injury of any profession out there, from lifting heavy patients to being exposed to dangerous pathogens. Incidents include things like death, loss of consciousness, days away from work, or injuries requiring medical treatment beyond just basic first aid. Crucially, hospitals have to track this for both their direct employees and contract employees. Managing this proactively doesn't just boost staff morale, it drastically reduces those massive workers' compensation costs.
Finally, let's look at Section 5, Quality and Patient Care, the ultimate value driver.
At the end of the day, every single financial, environmental, and operational metric we've talked about supports one ultimate goal: patient outcomes. It is the ultimate value driver for this entire industry. The most catastrophic failures in care are known as serious reportable events. These are serious, largely preventable incidents that trigger immediate public concern. We are talking about devastating errors, things like wrong site surgery, severe medication errors, leaving a foreign object in a patient during surgery, or serious patient falls. These are strictly tracked and reported to regulators because, quite frankly, they represent the highest level of liability and brand destruction for a healthcare provider. Entities also have to meticulously track hospital-acquired conditions. Think about it. If a patient comes in for a simple broken arm, but while they're there they acquire a staph infection like MRSA, a pressure ulcer, or suffer a severe post-operative complication like a surgical wound reopening, which is clinically known as dehiscence, that is a massive systemic failure. Tracking these incidence rates on a per-hospital basis helps management focus their efforts on improving care protocols and avoiding those excessive, incredibly costly penalties.
Another major red flag to look out for is the unplanned readmission. This happens when a patient is discharged but unexpectedly has to be admitted back into the hospital within 30 days. Whether this is due to an unresolved acute illness, a chronic issue, or just gaps in outpatient care, high readmission rates basically scream to regulators that the initial care might not have been sufficient. And this just drives up the overall cost of healthcare in a system that, as we discussed earlier, is already facing intense margin compression and serious financial strain.
But it's not just internal protocols that impact patient care anymore. It's also emerging, rapidly shifting macro threats. Climate change, for example, is introducing entirely new logistical and clinical risks. Hospital administrators now have to rapidly prepare for physical damage to their infrastructure from extreme weather events like hurricanes or flash floods. They also have to gear up for changing disease profiles, like suddenly seeing an influx of patients with heat-related illnesses or vector-borne diseases like malaria and dengue fever popping up in totally new geographical regions. Emergency preparedness? It's no longer just some hypothetical exercise, it is a daily, critical operational requirement.
So as we wrap up this explainer, we really have to look at the big picture here. Between the high fixed costs for specialized labor in massive facilities, the strict regulatory focus on slashing costs, the intense market competition, and these new emerging global health threats, the pressure on these institutions is just staggering. The metrics we looked at today, they are pretty much the only way these organizations can navigate the storm. But it leaves us with a really vital question to ponder. As extreme weather, rigid regulations, and high fixed costs continue to squeeze margins tighter and tighter, how resilient is the competitive infrastructure that literally saves our lives? Thank you so much for watching, and keep asking the big questions.